Thank you, Divya. Now, I invite Dr. Dhanya, Associate Professor, Government Medical College, Alappuzha, to talk to us on retinal evaluation with 90D and 78 diopter lens.
Very good morning to all. Of all these topics that we have heard, I think this is going to be the most familiar for all of you because you are doing this on a daily basis every day. Okay, so we'll discuss about slit lamp biomicroscopy using the 90D and the 78D lens. So, slit lamp biomicroscopy is a standard method for examining the posterior segment of the eye, and it gives you a very good stereoscopic high resolution view of the retina, the optic disc and the vitreous. We have contact lenses, non-contact lenses like these. The principle is by using a high power plus lens or a condensing lens, you are providing a bright and illuminated image, or you are getting a very good image of the retina. And so for that you need a bright focused beam which is provided by your slit lamp, and the microscope will give you a binocular stereoscopic visualization. And because it is a plus lens or a condensing lens, what the image formed will be an inverted image that is found between the observer and the lens. That it is an aerial image. Now, so I told you it's a real inverted and magnified image of the fundus. So it will be always inverted. So you have to tilt it in your brain. 90 diopter lens. It has got a very good field of view with a satisfactory image magnification, and it is help you to examine small pupils, even small pupil, for undilated examination. It also allows a pan retinal fundus examination, and it's a high index glass with an optical coating, so that will minimize all the distortions, reflections, aberrations, etc. 78 diopter lens, it is a good balance between magnification and field of view, and better stereopsis than the 90 diopter lens. So it is very good for detailed evaluation of the macula and the optic disc, and pupil dilatation is usually required. Now, when we look at a comparison between the 90 diopter lens and the 78D lens, see, look at the field of view. The field of view is more for 90 diopter lens, but the magnification is less, and the image brightness is slightly higher for the 90 diopter lens, and you get a wide field with a 90 diopter lens, whereas a 78D gives you a more detailed evaluation, or it is helpful for a more detailed evaluation of the macula and the optic disc. This is the equipment setup. We need a dimly illuminated room with the patient seated comfortably with the chin on the rest, and you have to focus the slit lamp on the pupil before introducing the lens. We'll go to the technique proper. So make sure that your eye is at the level of the marking on the slit lamp. You show the light is thrown to the pupil. Introduce the lens, keep it approximately 1 centimeters in front of the cornea. You have to adjust the illumination and magnification on the slit lamp, and then move the slit lamp closer, or the eyepiece closer, and finally you will get your image, which will be formed, as I told you, between the observer and the lens. So it is going to be a real inverted magnified image, which is an aerial image between the observer and the lens. In young patients, a wide pupil will permit you an undilated examination, and it doesn't mean that you are getting a stereoscopic view. So you have to check with one eye closed before you confirm that it is a stereoscopic view. Now, orientation problem. So when you begin, for a beginner using a 90 diopter lens, it is going to be a very important problem. See, you will getting an inverted image. It is side to side reversed, as well as it is turned up and down. So and another point is that at a point you are seeing only a small portion of the retina with your slit beam. So you have to assemble all these things in your brain in order to get a clear insight of the fundus. And also there are 3 moving parts. The eye will be moving, the slit lamp will be moving, as well as your lens will be moving. So what will you see? Now, we'll see when each part moves. So first, when the slit lamp moves to either side, so consider this is the right eye, and your slit lamp is moving to the right. The image that you see also will move to the right, and you will see more of the temporal retina. So this is, just imagine, this is the right eye. you move the slit lamp to the right side, the image also will move to the right, and you will see more of the temporal retina, and vice versa. Now, if it is your lens that is moving, when you move your lens to the right side, you can see that the image is moving to the left, and you see more of the nasal retina if it is the right eye. And if you want to see clearly the sides, when you ask the patient to move the eye sideways and up and down, when the patient eye move to the right, you see more of the temporal retina, and vice versa. Okay, so when the patient is moving the eye to the right side, you see more of the temporal retina for the right eye. Now, most often this is what happens when you are starting your examination. You will be stuck somewhere in the fundus, but anywhere in the fundus there will be retinal vessels. So how will you reach the disc? You have to trace the vessels. The vessels will it will act like a pointer. It will be like pointing you, and you move along the blood vessels, and finally you will reach the disc. Now, your 90D and 78D always help you to see usually up to the mid periphery, that is the opening or at the region where you have the ampulla of the vortex veins. So, for examination of the optic disc and macula, or the central retina or the posterior pole, as well as the mid peripheral retina, it is sufficient that you can use the 90D and the 78D. But for examination of the peripheral retina, definitely you need the indirect ophthalmoscope. Now, with this 90D, how will you evaluate the optic disc? See the disc margins or the scleral ring. This is the neuroretinal rim. The cup, which is the extra space. Look at the vertical disc diameter, the vertical cup size. You can also see the disc vessels, which are the veins, which are brighter and slightly larger, and the arteries, which are less bright, and the AV ratio is usually 2:3. Now, to measure the height of the disc, the vertical disc diameter, place a slit beam coaxial with the observation axis, adjust the vertical light beam, and you have to take the measurements from the scale reading if it is a Hague Street slit lamp, and the height in millimeters into magnification factor of the lens will give you the vertical disc height. Now, coming to the macula. Macula is the place where you have so many findings when you are looking at the fundus, because optic disc is easy to locate, as you have seen, but macula you have to look at the fovea, the foveal reflex, any changes in the macula, any edema, any hemorrhages, microaneurysms, or any exudates in the macula. As I told you have to hold the lens steady, and this 90 diopter lens will help you to give a two-dimensional view of the retina. And see, suppose this is a patient with a diabetic macular edema. You can see that there is an elevation at the macula, and only this 90 diopter lens or a 78D lens can give you that two-dimensional feel of that edema located at the macula. Now, what is this? This is all for postgraduates. Any postgraduates here? I don't think so. So, this is a macular hole. See, not only when you are using a 90D or a 78D, don't just look at the posterior pole, the disc and macula. Always you have to assume. Suppose you are seeing a hazy media. Suppose there is a trace of vitreous hemorrhage in that. Always you will have to look at the periphery and mid periphery. As in this case, there is a large retinal tear which is adjacent to the lattice in the supratemporal periphery. Just looking at the posterior pole, you don't see anything abnormal much, just for a mild vitreous haze, but there is a large retinal tear sitting there, and you have to barrage it. Also, what is this? This was a Weist reflex. Also, you will get vitreous opacities, hemorrhages, PVD signs are well visualized with the 90D lens. Now, this is a comparison of the visual fields. Your 90D gives you a very small view. This is a comparison that is with the 90D lens and the wide field retinal imaging. Still, by manipulating the lens, the slit lamp, as well as asking the patient to move their eyes up sideways, you will get a maximum view of the fundus. So, what are the advantages are? It's a non-contact method. It gives you a stereoscopic high resolution view of the fundus. It is quick and safe for our patients. And the limitations are the inverted image may confuse you initially, but I think now after a period, years of experience, it will automatically get set in your brain. And it requires patient's cooperation and steady fixation, and it depends on a clear ocular medium. Thank you.